Welcome, everyone, to our April edition of the Future of Vascular Health. So this week, we're going to focus on the impact of what's happened with COVID-19. And so the next 2 weeks will be focused specifically on COVID-19, and then we'll show you today our research and kind of what the statistics are, try to unravel all the stuff you've read in the news the last 4 or 5 years a little bit. And so you can see the actual impact it's had on people's health, their risk factors, especially if they have comorbidities. So Hans, I'm going to turn it over to you, and then I'll just probably ask you some questions along the way. So fire
Thank you,
away.
Bob. So, what we want to do today is talk about the COVID-19 pandemic, its effect on cardiovascular health, and also in our own studies, how the people that got infected by COVID-19, how it damaged their GlycoCalyx. So, from the top of my head, I think worldwide there were about 700 or 800 million people that got infected by the COVID-19 virus. So, I want to start a little bit with explaining how that virus entered our cells in our body and which organ systems are affected and how that caused serious risk of major adverse cardiovascular events or MACE, so heart attacks or strokes or cardiovascular related death. So this is a simplistic picture of the virus, how it binds to cell surfaces. So most people probably have seen a picture like this. So this is the COVID-19 virus. And on the outside of the virus are what's called the spike proteins. Then many cells in our body on the surface, they have a protein called angiotensin converting enzyme or ACE. So we talked about ACE before, the angiotensin converting enzyme in the presentation with hypertension. So it's an important enzyme that converts angiotensin into angiotensin. It's a part of that blood pressure control system. But many cells in the body express that protein on the surface. And for some reason, the spike protein part of the COVID virus really binds very well to that protein. And that's a way for the protein to bind to the cell and being internalized in different cell types and then cause all kinds of damage to different organ systems. So the next slide is an overview of all the different organ systems in our body that express that ACE2 receptor to which the COVID-19 virus could bind and cause damage. So there's ACE receptor expression in the brain, in the upper airways. I'm going to focus today on its effects on the vasculature, including the endothelial cells and heart function. But also, there's a lot of ACE in the lungs, obviously, in the liver, in the gut, in the kidneys, and the eyes. So many organ systems were vulnerable of being attacked by that COVID-19 virus.
So Hans, a question for you. So people that got the virus, it's possible that what you're talking about could have, I guess, attached or bound in the cells in these different organs in the body. And then that's potentially what would lead to the long-term COVID damage that people talk about.
Yeah, definitely. So there's many ongoing studies, and we know that many people after getting the initial infection, either serious that they had to go to the hospital or less serious and they could stay at home, that without knowing and after recovering from the initial infection, that many organ systems are compromised. So people have brain issues, they have increased risk for cardiovascular complications, they have kidney issues. So yeah, it's very well possible that that's related to the initial infection and the damage that the virus already did at that time in these different organ systems.
So what this points out then is that the COVID virus was a systemic assault to all the organs in the body.
Yeah, it's clearly, it's airborne, so people inhale it, it gets into the lungs, but it wasn't confined to the lungs. So it is binding on the lung cells, I guess on the ACE receptors on the lung cells, then incorporated into the lung cells and transported in the blood system, then circulating through the whole body and binding in different organ systems to different tissues. So yeah, it's a systemic challenge that people have been exposed to.
So as part of what you'll discuss further on, kind of how it binds?
Well, I'm gonna step away a little bit from the molecular shape and binding, but I'm gonna focus on the impact that the infection had on the people that got really sick, had to go to the hospital, how that affected their cardiovascular risk, so the risk of a heart attack or a stroke or cardiovascular death, just to get some perspective on the impact of the infection. And then I'm gonna move on to our own studies in which we looked at the damage that COVID-19 did on the GlycoCalyx in different studies that we did, and also the long-lasting effects of that damage.
Okay, look forward to it.
So the next slide shows the impact of being hospitalized with COVID-19 on your risk of getting a major adverse cardiovascular event. So that's a heart attack or a stroke or cardiovascular death. And this is a study that was done over the last 3 years after people were infected with the COVID virus. So as a function of time, these curves show the cumulative effect of the risk on a heart attack or a stroke. And I'll explain the different lines. So the lower line, people with low risk of getting a heart attack over the last 3 years, are people that did not get a COVID-19 infection and did not have to go to the hospital and didn't have cardiovascular disease. So they were low risk, and it also shows that very low risk of getting a heart attack and a stroke. However, the middle two lines, so the dotted red line and the black line, you can see these people, cumulative over 3 years, they have about 20% risk getting a heart attack or a stroke. And these are two different groups. There are people in there that do not have cardiovascular disease, so no atherosclerosis, no other complications of cardiovascular disease. The only thing that happened to them is they got infected with the COVID-19 virus and got really sick and needed to go to the hospital. So even 3 years afterwards, so they recovered and they went home. Over the past 3 years, that shows that they have a 20% risk of a heart attack and a stroke. And that risk is almost identical to the risk of people that did not get the COVID-19, but had cardiovascular disease. So getting the COVID-19 virus, going to the hospital, put you at the same risk of a heart attack and a stroke as the people that have cardiovascular disease. So that's a significant increase. If you compare, go ahead, Bob.
Do you think that explains why you read or hear of younger people that have cardiovascular events that are unexpected? It's because potentially it's what happened to them as a result of COVID.
So we know that the cardiovascular disease is typically a problem that develops with age. So many older people have cardiovascular disease, and that's why they have high risk of a heart attack or a stroke. But also many young people got infected by COVID-19. They got really sick and needed to go to the hospital. Even these young people that usually have a very low risk of a heart attack have much higher risk now of all kinds of cardiovascular complications. Then if you compare the people without cardiovascular disease and didn't go to the hospital because of COVID-19 with the people did go to the hospital because of COVID-19, even without cardiovascular disease, on the lower right, the increased risk, called the hazard ratio, is almost 6. Means you have a 6 times higher risk of getting a heart attack or a stroke without any cardiovascular disease if you were sick enough by COVID-19 you had to go to the hospital. And obviously it gets even worse. The top line is people with cardiovascular disease and that did get the COVID-19 virus and had to go to the hospital because of COVID-19. So compared to people that did not get COVID-19 and had cardiovascular disease, there's another twofold increased risk of people with cardiovascular disease have a twofold increased risk of a heart attack and a stroke by being affected by COVID-19 and get sick enough to go to the hospital. So it's a significant impact on everybody. Next slide is similar, just being a little bit more specific. This shows again the cumulative risk of a heart attack or a stroke over the last 3 years. And now the lower line is people that did not go to the hospital with COVID and didn't have cardiovascular disease or didn't have something called peripheral artery disease. So that's similar to cardiovascular disease, but then peripheral artery disease is in your extremities, like in your legs. So getting an occlusion, atherosclerotic lesion that limits blood flow to your legs or your arms, and diabetes. So people without COVID and no cardiovascular disease, no peripheral artery disease, no diabetes, as expected, have a very low risk of a heart attack and a stroke. So we normalize that risk to 1. So that's a reference level shown on the top right. So these are people without cardiovascular disease or diabetes, no COVID-19 hospitalization. So normalized risk of 1. And you see your risk of heart attack increases slightly if you get diabetes in the absence of COVID. It increases significantly if you have peripheral artery disease or cardiovascular disease, even in the absence of COVID infection. Then you get a similar level of risk if you get COVID infection without any cardiovascular disease, as shown also in the other slide, and even higher risk, obviously, if you have both cardiovascular disease and COVID infection into the hospital. And then similar as the other slide, but a little bit more different subgroups. It shows you that going to the hospital with COVID without any cardiovascular disease or diabetes or peripheral artery disease increases your risk of a heart attack or stroke by 7-fold. And then if you do have cardiovascular disease and then you have to go to the hospital with COVID, it increases your risk by 12-fold compared to the low-risk individuals without COVID and without cardiovascular disease. So again, it's a serious added risk of cardiovascular disease if you were sick enough by COVID and had to go to the hospital. So in our studies, we looked at the effect of COVID on the microvasculature. So obviously we used the GlycoCalyx system, as discussed before, to look at your sublingual microvascular health. So again, getting these kinds of videos, looking at the capillary, the really small vessels, and then counting the number of vessels that are blood perfused. So they're really the small capillaries. And as I discussed before, healthy individuals have more blood perfused capillaries than people with a damaged microvascular system. We also discussed this before. This is people at relatively medium risk for cardiovascular risk damage in the future. So compared to low risk individuals, being exposed to risk factors can already lower your capillary density by 30 to 50%. But what we saw in the COVID patients that got really sick and needed to go to the hospital, well, consistent with the other data I just showed on how much that increases your risk for heart attacks and strokes and cardiovascular death. So these individuals, when you look at their microvasculature with the GlycoCalyx system, they lose significant numbers of their capillaries. So the dark bars are the ones that the COVID patients that really needed support for breathing with a mechanical ventilator. They lost 90 to 95% of their smallest capillaries. But also the other people that got really sick with COVID had to go to the ICU. They lost up to 70% of their smallest capillaries. So their microvasculature really takes a big hit. It's really damaged by exposure to the COVID virus that, as you saw in the earlier slides, can bind to also the ACE receptors on the endothelium. So that gets into the vessel wall, gets into your endothelium, and that causes a lot of damage, including damage to your GlycoCalyx and losing a lot of your capillaries.
So question for you then. So you and I have both noticed a trend as we measure people. It's pretty easy to detect people that have had COVID because it's reflected in what we see on our calculations of the microvascular health score, the 4, 5, and 6 micron capillaries. You see a lot of people that lost a lot of those small capillaries.
That's correct. So they lose a lot of their capillaries, and as I will show you in a little bit later, Bob, is that also long long times after the initial infection, months up to years, their scores of the capillary density stay low, and also it takes a very long time for their GlycoCalyx to recover. So if we look initially, shortly after the infection, on the lower left, there's a level of GlycoCalyx damage. So these are the really sick COVID patients in the ICU, without or with a mechanical ventilator. So their PBR value, so our measure for GlycoCalyx damage, was significantly higher than in the healthy control. So a lot of GlycoCalyx damage, as expected, in the COVID patients in the ICU. And on the top right, that results, the low capillary density with the high level of GlycoCalyx damage results in significantly lowered scores for the microvascular health score. So instead of being in the 4 to 8 range, they drop down to the 1-ish range or well below 1 for the really, really sick COVID patients. And also another measure for GlycoCalyx damage is by measuring in blood samples the molecules of GlycoCalyx that are broken down by the virus. So two important molecules in GlycoCalyx, or polysaccharides in GlycoCalyx, are heparan sulfate, or the syndecan core protein of heparan sulfate, so shown in this graph. So it shows here that people with COVID, especially the ones that are really, really sick in the ICU, the concentration of heparan sulfate breakdown products in the blood significantly increases as a measure of GlycoCalyx damage, and the same for breakdown products of hyaluronic acid, another important polysaccharide in GlycoCalyx. Being exposed to the COVID virus caused significant increases in the level of hyaluronic acid breakdown products circulating in the blood of these COVID patients.
So when we did this study, this was another way to, I guess, double check the PBR values that we were seeing, which is the measure of the GlycoCalyx. We could actually see these, we could actually, as we drew their blood, we could actually find these items circulating in the blood, which would be consistent with the loss of glycogen.
Yeah, this is also helpful for us because over the years we have worked with many different groups that have many different tools to assess level of GlycoCalyx damage. So this is a biochemical assay. You take a blood sample, you measure in the blood the amount of GlycoCalyx breakdown molecules as a measure for GlycoCalyx damage, and that again here shows that it correlates very nicely with increased PBR in the same patients. With other groups, we did other comparative studies, like with the atomic force microscope that we discussed last week, or with electron microscopy that we did earlier. So there's a lot of other studies done by others correlating our PBR measurements of GlycoCalyx damage with other tools that confirm that PBR really represents GlycoCalyx damage. And in a few more slides, Bob, I also will discuss another study that we did, a so-called proteomic study, that people measured hundreds of different protein levels in the blood and see how they correlate with PBR and capillary density, and then use these protein levels as surrogate markers of glycocheck parameters to see how that correlates with all kinds of complications in these patients.
Okay.
Well, again, confirming the earlier slides that damage induced by the COVID-19 virus to your vascular system and your heart, it correlates with increased risk of heart attacks, strokes, and cardiovascular related death. This shows when these COVID-19 patients are in the ICU and the virus caused a lot of damage to your GlycoCalyx. So that's the red curve with high PBR values, a high level of GlycoCalyx damage. Then their chances of survival are very low. And the longer they are in the ICU with COVID-19 damaged GlycoCalyx, their chance of survival drop to less than 30% if they stay more than 2 months or 1-2 months in the ICU. Well, the ones that are still sick had to go to the ICU with COVID, but as long as their GlycoCalyx is in relatively good shape, for whatever reason, they are better, less vulnerable against for GlycoCalyx breakdown by the COVID-19 virus. So as long as their GlycoCalyx stays in relatively good shape, they survive their stay in the ICU.
So I think it's worth pointing out the healthy GlycoCalyx, even though they were hospitalized, if they had a PBR of 2.3 or lower, they weren't hospitalized as long. And so I think it's really important for those that have GlycoCalyx, because they measured people all the time that have PBRs that are higher than 2.3. And so that's not a good score, even at 2.3. Those
No,
were
2.3
sick
or
people.
higher, tells you something that is too high. We like to have people closer to 2.0 or less, or 2.1, 2.0. And this confirms that these really sick patients, when the PBR values are too high, your risk of organ damage and organ failure and all kinds of complications is very high. So you want to get that below 2.3 or closer to 2.0 as fast as you can.
Yeah.
Well, then the people that got out of the ICU, went home, or people that were not sick enough and recovered at home, you would think that would be it. The COVID infection took a few weeks and they recover, but apparently it takes much longer to recover, if people recover at all from the COVID induced damage. So this is some data that we collected with the Greek group that we discussed before, that also did the prospective study of following up on people for 6 years. They also did some follow-up studies on people infected by the COVID-19 virus. So they looked, compared to healthy individuals, people that were infected 4 months ago, or even people infected 12 months ago. And you see, even people infected 12 months ago, there's still increased GlycoCalyx damage in these individuals compared to healthy controls. So the damage continues for a long, long time. So this was a study for 12 months. But even if we look at people 2 years later, after they were infected with COVID-19, we look at the PBR value. So this was initially the PBR values increased by COVID-19, consistent with what Econometrics showed. But 2 years later, people that are complaining from all kinds of symptoms that we call long haul COVID, either brain fog, or they're tired, or other issues that they are experiencing, although their PBR value after 2 years sort of normalized back to control, if you look at the top right at their capillary density, so initially the capillary density took a serious hit, much lower than healthy controls, but even after 2 years, their capillary density is only back to 50% of a normal control level. So that might explain why they're so tired and have all kinds of other issues. And then if you combine the low capillary density with their PBR values, you can see also their microvascular health score significantly dropped initially by COVID-19, but even 2 years after being exposed to the COVID-19 virus, their scores are still very low in the 2-ish range compared to between 4 and 7 where they should be. So it takes much longer to recover, if they recover at all, these long haul COVID patients.
So we have 2 other studies we're just waiting to publish that we did with both these groups to take even a deeper look at this. So
yeah, so there's ongoing studies, and obviously we are very interested to see if we can help these patients with Revasca, and to see if we can help them restore their microvascular health, and if that recovery of their microvascular health also alleviates some of their clinical symptoms, and takes away the brain fog and their tiredness and the other risk for heart attacks and strokes, as I showed in the first few slides.
yeah.
Well, in addition to 50% of normal capillary density, also on the lower right, it shows that they have a much lower capillary recruitment capacity. So not only have lower numbers of capillaries, but also that number doesn't increase when they exercise or when blood flow goes up. So again, the recruitment capacity that is high in healthy controls means if your blood flow goes up like 2-fold during exercise, also you see 2-fold increase in the number of capillaries that are being perfused. You have a reserve capacity of more capillaries participating in exchange of nutrients and oxygen when it's needed, when you start using your brain or start using your muscle. well, that dropped down to very low levels initially after COVID-19 infection, but even after 2 years, it's very low level still. So you have low level of capillaries and hardly any reserve capacity. So that also contributes to the symptoms that people have been experiencing. Well, if we look at the top panels, so that's the red blood cell velocity, the blood flow in the small capillaries, or the blood flow in the somewhat larger vessels. So initially, there's a drop of blood flow velocity after COVID-19, both in the capillaries as well as in the larger vessels. And after 2 years, it looks like blood flow tries to be a little bit higher, like they're trying to compensate for the impaired capillary density. So the flow goes up a little bit. There's low numbers of capillaries, and one way of the body to try to compensate to increase blood flow to your microvasculature if capillary density is a little bit low. So there might be just a way to try to compensate for that loss of capillary density and that loss of reserve capacity. Just to there's always a little mismatch between what the tissue needs, so what you call metabolic demand, and what the vascular system can supply to your tissue cells. So when that happens, one way to respond is try to increase blood flow to those organs, try to compensate, but really it doesn't solve the issue if you don't have the capillaries to transport the nutrients from that increased blood flow to your tissue.
Yeah, so the important part of that is kind of what you just said at the end, which is, so the body's trying to compensate by getting more blood flow, but it can't spread the blood flow out to all of the cells and tissue. So it's just going through faster, which means the delivery of nutrients and oxygen and hormones is still compromised because it hasn't got the density to put that out to all the pieces of the body.
Correct. So yeah, you really need an intact microvasculature with a lot of capillaries and reserve capacity to optimally provide your organs with all the nutrients and oxygen that it needs.
Right.
This slide shows you the change, or the lack of change, better said, of your capillary density over time after the initial COVID-19 infection. So this is up to 2 years after the initial COVID infection. So not only is their capillary density much lower than it should be up here somewhere, but also you see there's no trend of increasing capillary densities even up to 2 years after recovering from the COVID-19 infection. And the interesting thing is that it not only happens or doesn't happen in the people that needed to go to the hospital with COVID-19, but also people that could recover at home. They both have low capillary densities, and they don't recover over time, the ones that are suffering from long-haul COVID symptoms. Similarly, for the microvascular score, they have a low microvascular score, it should be up here somewhere. And over time, if anything, the scores go down a little bit, even 2 years after the COVID-19 infection. Well, as I mentioned before, another study that we did in COVID-19 patients is not only do the PBR measurements and the capillary density measurements with the GlycoCalyx system, but also we collected blood samples and looked at hundreds of different proteins in the blood to see if some of the proteins correlate with the GlycoCalyx measurements. So from left to right, each little bar is one individual protein that was circling in the blood. So if you measure hundreds of proteins and look at the function of these proteins, in this case, comparing with GlycoCalyx parameters, we call it a proteomic study. So just measure different proteins in the blood and see what their function is, how it correlates with our microvascular or GlycoCalyx parameters with GlycoCalyx. So what we found is that some proteins correlate positively with PBR or GlycoCalyx damage. That means that the ones on the right, the green ones, that means high levels of PBR, high levels of GlycoCalyx damage, then that correlates with high concentrations of these proteins. And many of these proteins, we don't really know what their function is. We just correlate them with our GlycoCalyx parameters. So some proteins show high values with high PBR values, so they correlate with GlycoCalyx damage. And some proteins correlate negatively. So they show very low concentrations with high PBR values or high concentrations with low PBR values. So those are proteins that correlate with a healthy GlycoCalyx. So the green proteins correlate with a damaged GlycoCalyx, and the orange proteins correlate with a healthy GlycoCalyx. Well, same for capillary density. Some proteins correlate positively with capillary density. So those would be the healthy microvascular proteins. So again, the orange ones, some correlate with high capillary density. So the healthier your capillary network or your microvasculature gets high concentration of the orange proteins. And some correlate negatively. So some show a very low concentration of these proteins when your capillary density is high, or these proteins are higher when your microvasculature is compromised and you have a low capillary density. So again, the green proteins correlate with a damaged microvascular system, low capillary density, and the orange proteins correlate with a healthy microvasculature, a high capillary density. So based on these correlations of these proteins, some proteins correlate with low PBR, a high capillary density. So those would be, those would be the, let me go there again. So those would be the orange ones. So higher is better. So a high concentration of these proteins have less GlycoCalyx damage and higher capillary densities. And then we looked at the green ones that were the bad proteins that correlate with higher concentration of these proteins correlate with compromised GlycoCalyx and low capillary density. So if based on these two sets of proteins, one that are with a healthy microvasculature, ones that are with a compromised microvasculature, we could define a protein signature that is similar as our microvascular health score. So a high protein signature value would be a high microvascular health, and a low signature would be a low microvascular health. And then we could also use that signature in all kinds of other patients that we had blood samples, but not necessarily glycocheck parameters, to see how in different patient groups and different conditions their microvascular health would be compromised. So yes,
can
go
just
ahead.
go back if so you've got sepsis and COVID-19 both. So what we found was it correlated pretty closely, the damage that was happening to the GlycoCalyx, and therefore the organ decline between both groups of patients were very similar.
Yeah, that was actually striking in this study when we compared these proteomic correlations between PBR and capillary density. Those changes in protein levels were very similar in the sepsis patients, which is, of course, a very acute, serious inflammatory disease, and very similar to the people infected with the COVID-19 virus and got, inflammation because of the viral infection. So those blood profiles were very similar.
Yeah, so because we were already doing these studies on sepsis patients when COVID came around, it was easy to shift gears and then do it at the same time on COVID patients. And I think we were one of the first groups to publish papers showing just how serious COVID was to these people with comorbidities and the impact on their potential to survive.
Yeah, you're right, Bob. So if people pay attention to the years that we published these papers, that was all early on, so like 1 or 2 years into the COVID pandemic already.
Yeah.
So if we calculate that protein signature, then the pseudo microvascular health score, again, that gives you a normal high score in healthy individuals, and the score goes significantly down in people with sepsis or COVID, and goes down even further in the ones that have a higher so-called SOFA score. So that's a measure for how many organs are compromised. So microvasculature is seriously damaged in the COVID-19 patients, and even more damage in the ones that have many different organs being compromised.
So that graph, if you go back then, when it says SOFA, less than 8, it was less than 8 organs were damaged versus greater.
Yeah, it's correlated to the number of organs failing. Yes.
Right.
And then the last slide here is using that protein signature again as a measure for your microvascular health, to look at different parameters that we know are important to predict risk of all kinds of complications in the COVID patients. So one of these parameters is the D-dimer level in blood samples, which is a clotting factor. So high D-dimer levels gives you very high risk of blood clots and all kinds of coagulation disorders. So we see that the patients with a relatively high protein signature or high microvascular health have very low levels of D-dimer. And the ones that have high levels of D-dimers have very low microvascular health as predicted. So a lot of GlycoCalyx damage and loss of a lot of capillaries in people with very high risk of clotting risks. Similarly, on the lower left, in the COVID patients, we looked at patients that could breathe on their own without additional oxygen, ones that needed additional oxygen to breathe, ones that needed to be intubated, and the ones that didn't survive. So again, the healthiest COVID patients had the highest protein signature or the highest health of the microvasculature, so less GlycoCalyx damage and less loss of capillaries. And the ones that got really, really sick were the ones that had a lot of microvascular damage, as similar as in that ICU survival study that I showed before. And again, when we combine the intubation and death as a risk parameter, COVID patients in the ICU that did not need intubation or survived their stay at a much higher protein signature, much higher microvascular health than the ones that were really, really sick with intubation and didn't survive their stay. So again, confirming that a healthy microvasculature, either by your own level of protection or taking treatments that help you improve the microvascular health and protect your GlycoCalyx, really have an impact on the way the COVID virus causes damage to your organs and your chances of survival. So with that, Bob, I would give the word back to you.
Thank you, Hans. I think what our message today, I guess, confirms is that indeed COVID virus was a serious thing. And that's why, so many people died from it. But I think maybe we'll talk a little bit more about it next week, and that's long haul COVID. But it's striking that so many people, even if they weren't hospitalized and just were able to recover at home, still haven't completely recovered. And we see that they still have an impact from the COVID virus as far as it affects their microvascular system, the health of their GlycoCalyx. And so it also then affects their systemic organs, like you showed at the start of our presentation. So we'll talk a little bit more about that next week, and then we'll talk about and show some of the studies we've done on what do you do about it part that we like to talk about. And we'll talk about that. Does that sound about right to you, Hans?
Well, thank you. Looking forward to next week.
Okay, thanks everyone. We'll see you next week.
Thanks for listening to the Future of Vascular Health. Healthy vessels, healthy future. If you're ready to take charge of your health, it's time to check out Revasca. This powerful supplement is designed to protect your GlycoCalyx, the microscopic layer that keeps your blood vessels healthy and strong. Revasca can help support your heart health, improve circulation, and even reduce high blood pressure. It's also great for boosting brain function, keeping your kidneys healthy, and preventing vascular complications before they start. Think of it as a way to keep your body running smoothly so you can live longer, feel sharper, and stay active. Don't wait. Take the first step toward better health today. Visit GlycoCalyx.com to learn more about Revasca and how it can help you protect your future.